The pediatric wing of Harbor Ridge Military Medical Center had seen wounded soldiers, frightened families, and miracles that defied every medical prediction. Yet nothing compared to the silence that settled over the hallway the morning Captain Daniel Brooks's son arrived. 7-year-old Liam lay unconscious on a hospital bed after a devastating vehicle accident. Beside him stood Rex, a powerful Belgian Malinois military canine with a scar across his muzzle and eyes that never stopped watching the room. No one could get close. Every doctor who stepped toward Liam was met with a low growl. Every nurse who reached for the boy's IV was forced back by bared teeth. Military police kept their distance. Even Rex's own handler couldn't calm him. "He's never acted like this," the handler whispered. The chief physician sighed. "We can't treat the child if that dog won't move." Across the nurses' station, Emily Carter quietly finished organizing medications. She had transferred from another military hospital only 2 weeks earlier. Nobody knew much about her. The senior staff simply called her the rookie. One nurse smirked. "Perfect job for the new girl." Another laughed. "Maybe the dog will listen to her." Several people chuckled. Emily looked toward Liam's room. "What happened?" "The boy's father is a Navy SEAL captain," someone answered. "Missing during an overseas operation." Rex was his partner. Emily nodded slowly. "So the dog is protecting his family." The chief physician overheard her. "Can you solve that too?" A few nurses laughed again. Emily ignored them. She walked calmly toward the doorway. Rex immediately stepped between her and the bed. The growl returned. Military police instinctively reached for their weapons. "Back away," the handler warned. Emily didn't move. Instead, she slowly lowered her eyes. She relaxed her shoulders. Then she made a small movement with her right hand. Nothing dramatic. Just 3 quiet finger taps against her left wrist. Rex stopped growling. The entire room froze. The dog tilted his head. Emily repeated the same signal. 3 taps, 1 closed fist, an open palm. Rex slowly stepped backward, his ears lifted. The handler stared in disbelief. "No." Emily took another careful step. Rex sat down, not because he was ordered, because he had recognized something. The handler whispered, "That's an old Special Operations Canine signal." Every eye turned toward Emily. The chief physician frowned. "How do you know that command?" Emily looked at Rex. "He remembers." Rex gently rested his head against her hand. The hallway fell completely silent. The handler slowly shook his head. "That signal was retired years ago." Emily smiled faintly. "I know." Before anyone could ask another question, Liam's heart monitor erupted into a piercing alarm. The steady rhythm suddenly became dangerously irregular. Doctors rushed toward the bed. The chief physician shouted, "Move now." Emily looked at the monitor only once. Then her expression changed. She turned toward Rex. The dog wasn't looking at Liam. He was staring directly at the oxygen line beside the bed. Emily's voice became sharp and urgent. "Stop." The room froze. She pointed toward the tubing. "Don't touch the patient." The chief physician stared at her. "Why?" Emily never looked away from the line. "Because Rex isn't protecting the boy." She took one slow breath. "He's trying to warn us." The room fell silent. Every eye shifted from Liam to the oxygen line. The chief physician frowned. "What do you mean the dog is warning us?" Emily stepped closer without touching the bed. "Look at Rex." The Belgian Malinois wasn't watching the frightened doctors. He wasn't watching Emily. His eyes never left the clear tubing connected to the wall outlet. Emily slowly traced the line with her gaze. Halfway down, it disappeared behind a mobile cabinet. She knelt. Something immediately caught her attention. The line is kinked. A respiratory therapist quickly moved the cabinet. The oxygen tubing had been crushed beneath one of its wheels. Airflow was barely reaching the child. The therapist checked the flow meter. "It isn't delivering the prescribed oxygen." The chief physician's face went pale. "Fix it." Within seconds, the tubing was replaced. Fresh oxygen reached Liam. His heart rhythm improved almost immediately. A relieved sigh spread across the room. The chief physician looked at Emily. "You trusted the dog." "I trusted what he was trying to say." The canine handler stared at Rex with disbelief. "He wasn't guarding the boy." Emily nodded. "He was guarding the problem." Before anyone could respond, Liam suddenly began struggling to breathe again. His saturation is dropping. The respiratory therapist checked the equipment. Everything's working. Emily leaned over the child. His breathing sounded different now, not shallow. Restricted, she gently examined his neck. Then she looked at the monitor. Finally, her eyes stopped on Liam's left shoulder. "No." The chief physician hurried over. "What is it?" Emily carefully lifted the blanket. A dark bruise had spread beneath the collarbone. "It wasn't there before," she whispered. The physician examined it. "Internal bleeding." Emily shook her head. "Not exactly," as she pressed lightly around the area. Liam winced even while unconscious. The physician looked confused. "What are you thinking?" Emily answered immediately. "A fractured clavicle has shifted. How can that affect his breathing?" "It can compress nearby structures." The physician ordered an emergency portable scan. Seconds later, the image appeared. Everyone stared in disbelief. The broken bone had moved dangerously close to major blood vessels and was restricting the airway. The surgeon looked at Emily. "You caught that before the scan?" She remained focused on Liam. "Prepare surgery." The operating team rushed into action. As they wheeled Liam toward the operating room, Rex suddenly stood and blocked the hallway again. The handler sighed. "Not again." Emily studied the dog. This time his ears were forward, his eyes fixed on the backpack hanging from the IV pole. Emily frowned. "That bag wasn't here earlier." A young orderly stepped forward. "I brought it from the ambulance." Rex growled louder. Emily unzipped the bag. Inside were Liam's clothes, a small toy airplane, and a sealed waterproof envelope. Across the front were 4 handwritten words, "For Captain Brooks only." The hallway became silent. The K9 handler slowly looked at Emily. Daniel never let confidential mission documents leave his side. Emily carefully opened the envelope. Instead of papers, she found a tiny encrypted data drive. At that exact moment, Rex stopped growling. Emily looked up. He wasn't protecting the envelope. The handler frowned. "Then what?" Emily's expression changed. "He was making sure it reached the right person." Before anyone could answer, every light in the hospital flickered. A security alarm echoed through the building. Then an urgent voice came over the intercom. "Attention all staff. The hospital is in lockdown. Unauthorized individuals have entered the facility." Rex immediately moved beside Emily. His eyes locked onto the corridor. Someone was coming, and they weren't there for the child. The hallway lights flashed red as the lockdown alarm echoed through Harbor Ridge Military Medical Center. Nurses hurried frightened families into secure rooms while security officers sealed every entrance. Rex stood beside Emily, perfectly still, his eyes fixed on the corridor. "He sees them," the K9 handler whispered. 2 men wearing stolen hospital uniforms appeared at the far end of the hallway, pushing an empty stretcher. At first glance they looked like medical staff, but Rex let out a deep growl. Emily noticed something everyone else missed. "They're wearing surgical scrubs," she said quietly, "but military boots." The chief of security turned. "Stop right there!" The 2 men abandoned the stretcher and ran toward the operating wing. "They're after the envelope," Emily shouted. Security officers gave chase. One intruder reached the operating room doors where Liam's surgery had just begun. Rex exploded forward with incredible speed, intercepting the attacker before he could enter. The trained K9 held him to the floor until military police arrived and secured both suspects. Minutes later, investigators searched the abandoned stretcher and discovered concealed communication equipment, forged hospital identification cards, and restraints. The intruders had never intended to harm random patients. They were targeting Captain Brooks's confidential mission data. The encrypted drive inside the envelope contained evidence that could expose an international smuggling network responsible for the deaths of several undercover agents. Captain Brooks had hidden it with the one person he knew his enemies would never suspect, his son. Meanwhile, Liam's surgery continued. The operating team successfully stabilized his fractured clavicle and repaired the internal injuries before they became life-threatening. Hours later, the surgeon stepped into the waiting area. "He's going to recover." Emily closed her eyes in relief. Rex gently rested his head against her shoulder, as if he understood every word. The next morning, another helicopter landed outside the hospital. This time only one passenger stepped out. Captain Daniel Brooks. Thin, exhausted, and still wearing the uniform from his rescue mission, he hurried through the hospital until he reached Liam's room. His son was awake. Died. Daniel embraced him carefully, unable to hold back his tears. Then he turned toward Rex. You kept your promise. The loyal canine wagged his tail for the first time since arriving. The handler smiled. He never stopped protecting your family. Daniel looked at Emily. I've been told you trusted my partner when nobody else did. Emily smiled softly. He trusted me first. Daniel noticed the old hand signal she had used. You served with military canine units. A long time ago. My team retired that signal after one mission. Emily nodded. I was there. For a moment, neither of them spoke. Some memories required no explanation. Later that afternoon, the hospital director gathered the staff together. He looked around the room. Yesterday, many people underestimated Nurse Emily Carter. Several nurses lowered their eyes. She listened when others laughed. She observed when others assumed. Because of her judgment, a child survived, classified evidence was protected, and 2 dangerous suspects were captured. The chief physician stepped forward. I owe you an apology. Emily accepted it with quiet grace. We all learn by listening. The nurses who had mocked her thanked her for teaching them that courage often appears in the calmest people. Before leaving the hospital, Captain Brooks clipped a small military challenge coin onto Emily's badge. One side showed the Navy SEAL emblem. The other showed a Belgian Malinois beside a single word, loyalty. You earned this, he said. Emily looked at Rex one final time. The faithful canine walked beside his captain and young Liam as they disappeared through the hospital doors together. Some heroes protect with weapons. Others protect with compassion. And sometimes the bravest voice in the room belongs to the one willing to trust a loyal dog when nobody else will. If this story touched your heart, subscribe for more emotional military and medical dramas celebrating courage, loyalty, and the extraordinary heroes who change lives when every second matters.